If you're a parent worried that your child is spending too much time on Facebook and social media, there's reassuring news in the latest research.
The UW School of Medicine and Public Health took a look at the effects of social media on children and adolescents and the risk of something called Facebook depression. Dr. Megan Moreno was one of the lead researchers, and she's with us tonight to tell us all about it. Welcome to Live at 5.
Thank you.
This is fascinating because this is something most moms of teenage kids are dealing with, the vid kid generation. What did you do for your survey? How did you do your study?
Well, we were very interested in getting an extremely accurate look at internet use, because with how much kids are on social media and the internet these days, between their cell phones and the computer, we knew that it was difficult for them to get an accurate sense. So we actually used technology to measure their technology use by texting them. We texted them a total of 43 times over a week and asked them how much they had been online and what they were doing. So we felt like we had this really solid way of being able to understand how much they were on the internet, and specifically how much they were on Facebook.
So tell us about this idea of Facebook depression. What is it?
Well, the American Academy of Pediatrics about a year ago came out with some social media recommendations, and within that report they raised a red flag that too much Facebook use may lead to depression. And on my research team, we really thought a lot about that. As you mentioned, parents have enough to be worried about. They're trying to figure out what is real within social media, what are the guidelines we can give. And so I was fortunate at the time to be working with a public health student who said, we can find out the answer to this. We can look at this, and that's really what drove this study.
And what did you find? Is there a connection?
We did not find an association with the amount of time that one spends on Facebook and whether or not you reported depression symptoms.
Well, that's
so that was very reassuring, yes.
But there had to have been cases where, I mean, we've reported on this, where bullying has gone up on these social media sites. Is that a concern that parents should still look out for?
It's definitely a concern, and I think our study, it really gives some reassurance regarding this suggested relationship that the amount of time you would spend on Facebook would directly correlate to Facebook depression. So we can be pretty reassuring about that, but what our study doesn't get at, and what we need a lot more work on, is things like cyberbullying. Things about not just how much time you're on Facebook, but what are you doing on Facebook? And I think hopefully our study sheds light on the idea that parents can be involved with their kids' social media use, ask them what they're doing, who they're hanging out with, but the absolute number of hours, parents don't need to stand by them with a stopwatch and say, oh my gosh, you're at 2 hours, you're going to become depressed, you must log off.
Boy, that is reassuring. That is very reassuring. And did it determine what age is the appropriate age for something like Facebook?
It's a great question. I think that is definitely a matter of debate and controversy now, especially since Facebook is talking about lowering its age limits.
Yeah, well, my son is 13, and he just got on. And I'm going to tell you, that is some angst for a parent. I mean, it's a brave new world, you know?
It is. It is.
Absolutely. But it's here to stay.
It is.
It is here to stay.
And Dr. Moreno, where can people read more about your research?
We have a website on the UW Health website that shows some of our recent studies. We're really interested in social media, as you can tell, and how it weaves into the lives of today's adolescents and their health.
Very, very interesting. Thank you so much for coming in tonight.
Thank
Appreciate
you.
it.
And we'll be right back after the break.